Welcome back to London Calling 2024. I'm so excited to be back with you again, our virtual audience, and I hope you enjoyed all of yesterday's talks. We have a jam-packed agenda today, plus tomorrow is our first ever Clinical and Biopharma Day. And while it's not being live streamed, you will be able to catch up with the talks on demand, plus all the rest of the content that you've seen already. I'm really enjoying seeing all of your stories coming in and hearing about your Nanopore journeys, so do keep sharing them on Twitter using that hashtag NanoporeConf. Yesterday, I asked you what you're most excited about. Most people said about hearing about the latest applications that Nanopore technology can be used for and hearing about the updates. Well, hopefully you enjoyed the talks from Cecil Jewell, our Head of Applications, and also our CTO, Clive Brown. But if you did miss those talks, you can already catch up on them on demand. If you haven't already had a go, why not try the Spot the MinION competition? Just head up to the nav bar on the top of your screen and see if you can be our top scorer. Oh, and while you're at it, click on that QR code in the top right-hand corner of your screen and be part of our virtual audience. We love seeing your pictures, and they're displayed after and before every plenary talk. Okay, it's time to head over to the studio, so I'm going to throw it over to Zoe McDougall for one last time. Over to you, Zoe.
Welcome everyone to day 2 of London Calling, and before we lose Rosie off the monitor there, we just do want to say that Rosie, who has done so much for Oxford Nanopore and London Calling, has spent the last few years studying for her law finals. She's got her law finals in 2 weeks. If anyone's on Twitter, please wish Rosie Calderbank the best of luck. Absolutely amazing. So we're joined here in the studio this morning with 3 of my favourite guests. We've got Kathleen Barnes, who is our very own Senior Vice President of Population Health and Precision Medicine. We have Justin O'Sullivan, who's joined us from the Liggins Institute all the way from Auckland. So Justin's got a bit of a body clock thing going on today, but he's doing really well. And of course, Ewan Birney, who's Director of EMBL-EBI. So thank you so much for joining us today as we just warm up for London Calling. So first, I've got to ask, Clive did his big tech talk last night. What was the highlight? Ewan, what was the highlight for you of Clive's talk?
The highlight, the thing which I was just very, very happy to see was the improvement in the quality and the ramp that is there in the future for quality improvements. It's long been this frustration, I think, with Nanopore. Lots of features have worked, but the fundamental base quality does cause some concern and makes life much harder. So if you go back 2 years ago, it was a much tougher gig to analyze Nanopore reads. Now it's much easier, and just seeing that come through was great. The other one, which I quite like, I mean, the yeast chromosome was amazing, but they are quite small, so I'm looking forward to bigger ones in the future.
Well, I think it was great to see Indels really closing. I think that's the last bastion, isn't it? And everyone was really happy to see that. So, Justin, what do you think?
So the thing I enjoyed the most was actually when he showed the Gargantuan, right? I mean, I think it was actually quite funny watching the audience and how they were responding. But aside from that, I think it's the multi-omics that's coming through, and I think that's the thing that we really like, because, you know, doing the methylation, the long-read RNA, doing the DNA sequence all at the same time, same samples, I think the power that brings in, and if you can in fact actually bring in other molecules to it as well, metabolites and things, those sorts of things I think are going to make it like a step change in the way we can do clinical trials in situ in places where, you know, you just haven't been able to do it like that before.
Fantastic. It was really fun watching the audience on that slide that Clive did start to get the fact that it was a practical joke, like over the first few seconds. That was a real moment. So, Kathleen, what was your highlight?
I echo Ewan and Justin. Those were my favorites. I think also the promise of a 15-minute genome. That's a game changer. And when we think about diagnostics and clinical applications of the technology at the point of care, incredible opportunities there.
And we said in 2012 that a 15-minute genome would be possible, and with the voltage chip on the way and a device to put it all together, a 15-minute is absolutely within reach. It really is. So you've all mentioned this journey. Today we're going to see the presentations go from bench towards the bedside. We're really talking about translational implementation processes and a lot of the presentations today. So I'm sitting here with 3 people on the sofa. We've got the UK, we've got Auckland, we've got the US. What are the challenges, and are the same challenges present across the world for bringing science from the bench to the bedside? Kathleen?
Well, I think that's where I'm going to start off with. One of the presentations that I'm just so excited about is Karika Weldon of Carry Genetics, talking about what they're doing with building the infrastructure for in-house testing, primarily for breast cancer and prostate cancer in Bermuda and across the Caribbean. And why is that so important? I mean, I think it checks all the boxes in terms of the power of the Oxford Nanopore platform, in terms of enabling scientists and providers in parts of the world that traditionally, if they even could sequence, would have to outsource that. It checks the box of what we don't know in terms of just take breast cancer, 5 to 10% owed to what we think are the usual suspects. They're already making novel discoveries in women of African ancestry. And I want to make a pitch, if I could, for Karika's NUCO. Just very excited about what she's going to have to talk about. So I think, but to your point, Zoe, we're going to hear a lot about multi-omic applications, long-read RNA and adaptive sampling and pharmacogenomics. So it's an exciting day.
Well, Justin, would you like to share a little bit about the work that you're doing in Auckland and how you see that challenge of moving it further into the clinic?
Yeah, okay, so I mean, in Auckland we're doing trio sequencing, so in acute care genetics. So children in neonatal intensive care, pediatric intensive care, and we're doing basically trios there, trying to get around ancestry problems because, Maori Pacific populations are not very well represented in the international databases, but if we do the trios, then we account for that really quickly. So then we can link that through to a human phenotype ontology-based analysis using a Bayesian AI system, Fabric GEM, fantastic system, helps us rank the variants, get back information very quickly, which reduces the number of curators that we need. Doesn't remove them, but it reduces that, which really helps us. I mean, it's about skill sets, it's about growing the people. New Zealand, I think I was talking to Ewan before, it's a big country, geographically it's bigger than England. There's only 5 million people, right? So, we have issues around that. And so that's one of the key things for us, is getting that to work. But then we have social license. And I think social license is something that, sometimes we don't talk about enough because it is about DNA, that's fine, but it's about people, and we're dealing with people and we're talking about people. And we're talking about not just the information that's come from their parents or their ancestors, we're talking about what's going forward. And so a lot of cultures have a lot of, that's very important to a lot of cultures. And so I think social license is one of the big issues that we have to deal with.
That's really interesting. Are you doing work with the Maori population in New Zealand to understand the genetics of that population? Is that driven by the community or is it a difficult issue to navigate?
So I'm personally not there is a very own project which is being run out of the University of Otago by a colleague of mine, Stephen Robertson and Phil Wilcox. They're doing that, and that is Maori-led. We have a Treaty of Waitangi which puts a certain sort of scope on this, and a requirement for us to deal with that, which is great, and it works really well, But again, it's about skill sets, it's about the right people and connecting with people, and really just communicating and co-developing what we're trying to do. And I think if we do that, it's the same as moving things into places like Jamaica and other places, right? It's empowering the people who are actually going to do the work to do it. And this technology, we only started doing this last year, so we're babies here, right? And I think that basically, you can do it really quickly. It's very simple to implement. I am looking forward to that 10 terabyte chip, right? I think that'll be something else,
Well, I think that's true. And Ewan, obviously you have seen all of the work happen through EBI, but also you're on the board of Genomics England. So you've seen a lot of the sort of early push of establishing infrastructure to bring genomics into care. What do you think the opportunities are as we stand here today for the next 10 years?
So a number of places in Europe, the UK is a good example, has got quite comfortable about using genomics in the clinic in a variety of places. What I think is really exciting is the opportunity that Nanopore gives in cancer, because there is this combination of fast time to result, the ability to move the machine really close to the clinic. You don't have to centralize these machines. Long reads, so you can see structural variation, aneuploidies, and these other things. And then, of course, methylation and hydroxymethylation coming in the same experiment as your genomics experiment. So rather than having multiple assays that you have to order at different times, it's a one-stop shop for many, many questions in cancer. Now, in Genomics England, there are 2 genomic laboratory hubs, GLHs, with Prometheans running now, and they're starting to put more and more clinical samples. Michael Hubank is somewhere in this audience tweeting away. And I'm really hoping that that will move to more locations now across England and indeed across Europe, where people can really try and get that very, very fast, so under 24-hour feedback. So sample comes in, biopsy comes in. The next day, the oncologists have both the in situ images and that first pass genomic analysis to hand to make informed decisions. Just to say, I mean, I think the clinical stuff is brilliant. It's wonderful. I think there's a huge amount of applications outside of human, as it were, and I'm just excited about the environmental side of Nanopore as well. Very different community in many ways, but still powered by the same fundamental DNA measurement. In many ways, I think of measuring DNA very similar to taking pictures or imaging. You know, we can use it in so many diverse ways in life, and DNA is a fundamental molecule that we really want to know about. And Nanopore gives you that really immediate, really now accurate and complete view of what's in your sample.
That's fantastic. And only yesterday we were sequencing 10 critically endangered species on Promethean right out here in the live lounge, including the rockhopper penguin, which is my personal favorite. So in the 2 minutes we've got left, quickly, what are the talks we should be most excited about today? Kathleen, what are you going to be turning up to?
I'm definitely going to be at Kareeka Weldon's presentation. Also super excited about Eddie de Boer from Groningen. The work that he's doing with advancing diagnostics using long-read, the long-read RNA sequencing story for Alzheimer's, showcasing a talented PhD student here in London. So,
yeah, the showcase is absolutely key. What about you, Justin? What's most exciting?
Yeah, so I'm interested in the long-read RNA work, right? I mean, I think one of the things that population genetics has led us to in genome-wide association studies is that we talk about genes still as a gene, right? And the long-read stuff is actually showing us that, you know, it's not a gene. There's the different transcripts and reinforcing the fact that there are these transcripts, these isoforms, and it's the different isoforms that are actually the key to what we're looking at in the disease. So, you know, getting past that way we think about genes again, even though I know for a long time the hypothesis has been there, and it's not one gene, one protein, but I think we fall back to that a lot, just in the way that we describe things, and I think that's where we're going to see a lot of differences, and it's really exciting.
Ewan, should we remove the word gene from the lexicon and replace it with something else?
No. It's a very useful word, but I totally get that it can be limiting if you treat it as a straitjacket. In terms of what I'm looking forward to, there are 2 things. One, actually, I'm really looking forward to Rosemary's talk, because I know there's this very, very practical business of, okay, you know, Clive often talks about where Nanopore is going now and, you know, the next year and the steps ahead. Rosemary tells you what you can get now, basically. You know, I'm sat here now, I'm designing a project. What can I do now? So that's Rosemary's talk. And then I'm also really excited in these experimental decorations of DNA. So that's where we're using DNA modification as a readout, as like a multi-channel readout on a DNA tape. And it's a kind of chip-seq and these other cutting technologies are being replaced by modification technologies, this time with Nanopore, the modified Nanopore for the readout. The exciting thing for my colleagues there is you've got more than one channel. You've kind of got more than one color to look at, one type of modification for that.
Absolutely. Well, thank you so much. We're out of time. Rosemary is just about to do a bit of a state of the nation of nanopore sequencing as it is today. She's going to be talking about making the possible practical, making the practical possible, and also going to be talking about how we're moving into more regulated environments and markets. So we're really excited about that. Over to Rosemary.